Yes, I can see your screen.
Yeah, we are seeing.
The last time we met, which was yesterday, we discussed the theory of reasoned action. We discussed its advantages, and then we went through the social cognitive theory. We discussed its advantages as well, and we were also able to discuss the constructs of social cognitive theory in there, including self-efficacy, observational learning, where individuals learn by observation, and the reciprocal determination in which the social cognitive theory works. We looked at the TTM that shows that behavior is in stages from pre-contemplation to contemplation, preparation, action, and then maintenance, and later termination of that particular behavior. And we also looked at the constructs here, and we discussed the advantages of that theory. Then we looked at the diffusion of innovation theory, which proposes that adoption of an innovation occurs through a series of stages. And we were able to look at the diffusion of theory, the back. So I was just saying we looked at the different categories of people in the adopter categories of the diffusion of innovation theory, that different people adopt a new idea in a different manner. And we looked at innovators as people who are very explorative, who want to learn. The early adopters looked at the early majority, the late majority, and the laggards. Then we looked at its criticism as well. And then lastly, we looked at the socio-ecological module in there. So today, we wish to include what we call health communication. We've been discussing health promotion, health education, health communication, but we've not had an understanding of what health communication has been in detail. And in this lecture, we shall one discuss health communication, but also we shall discuss health education as the two components that combine to form a comprehensive health promotion project or idea. So in this lecture, we expect that we understand the term of health communication. We shall be able to understand the functions of health communication, but also later we shall be able to understand what are some of the strategies for developing health communication messages. So to dive into the issue, health communication is the study and use of communication strategies to inform and influence people to make choices about their health. Messages are spread through different channels such as mass media, print material, social media, and face-to-face conversations. According to Healthy People 2010 guidelines, health communication encompasses the study and the use of communication strategies to inform and influence individual and community decisions that enhance health. So these two are definitions, but the second one is according to the Healthy People 2010 guidelines, and they are giving a comprehensive definition of what health communication is. So it is not just a matter of talking, but you realize it starts with a study. A study meaning that you're able to have a deeper understanding of the people or the community or the individual that you intend to talk to or offer information. So it is Health education, communication, sorry, is a very comprehensive aspect in that self, meaning there are different strategies that are being used to inform the people, and you try so much in your health communication to influence the individual and the community to enhance their decision making, meaning most times the aim is that we positively enhance their uh, decision making. So health communication encompasses the study and use of communication strategies to inform and influence individuals and community knowledge, attitudes, and practices with regard to health and healthcare. That is just another definition. So those are three different definitions trying to point out at the fact that the communication involves studying, but also informing and influencing individuals or communities. So, what are the functions of health communication? Functions, when we're talking about functions, we are talking about propelling, how what communication aims at, or what its propelling strategy is. And we are looking at the main function of health communication is to provide scientific knowledge or or information to people about health problems and how to maintain and promote health. So the first function is information. So first, information should be easily accessible to the people so that we can remove or eliminate social and psychological barriers of ignorance, prejudice, and misconceptions people may have about health matters. Increase awareness of the people to the point that they are able to perceive their health needs and influence people to the extent that unfelt needs become felt needs and felt needs become demands, according to PAC 2015. So this will help to eliminate misconception. So whereas you are studying and influencing people, you're not only influencing people on different ideas, you're giving them information. For example, if you have misconceptions about use of smartphones in a particular community, you will need to inform them. You will need to demystify some of the myths that are in the community. We have myths about condom use, we have myths about health facility delivery, we have myths about antenatal care, we have myths about vaccination, immunization services, we have myths about HIV testing, we have a lot of myths in the healthcare system. But also we have a lot of myths in our cultural setting that may not be very healthy. For example, in certain cultures in Eastern Africa, they believe that circumcision should be done using one knife or one unsterilized sharp object. So these are some of the myths that may cause uh, increase or public health threats like HIV or other fluid spread illnesses. So it is very important in health communication that you provide information. Another key aspect here is another function is education. Education plays a very important role in prevention-oriented approach to health and disease problems, and the basis of all education is communication. Health education can bring about changes in lifestyle and risk factors of disease. It can help to increase knowledge and to reinforce desired behavior patterns. It can also increase knowledge and awareness of a health issue, problem or solution which influence perceptions, beliefs, attitudes, and social norms. You realize there are a lot of health talks or what people call health education sessions in the majority of the health facilities. And it is very important to conduct these things because they help in the prevention oriented approach. That before an individual becomes ill or becomes uh, diseased, the person has information or has been communicated to by providing this health education. And in this package of health education, there is always informing of individuals so that they have information in order to practice prevention measures. Education is very key, especially in key populations. For example, if we are talking about sex workers, you realize majority of them may be ignorant about some of the ways in which they can protect themselves. But we realize in health that whereas religious people would say that do not provide them with contraceptives such as condoms because what they are practicing is unreligious. In health, you if you left them, then it would cause you a community burden. It will become a community burden because these people will continuously practice sexual work, and at the end they impact the community in terms of spread of disease. So this is very key uh, function of communication. Another function is motivation. One of the goals of health communication is to motivate individuals so that they can apply the health information into personal behavior and lifestyle, which will bring forth the benefit of behavior change for their own health. So, motivation includes the stages of interest, evaluation, decision making, among others. For proper success of program implementation at individual and society at large, motivation assists in passing from the state of awareness and interest to the final stage of decision making and adoption of the new ideas. So, motivation is an encouragement, whereas as you're communicating, uh, you may encourage someone to be able to go and take an antiretroviral uh, treatment. Someone may go and pick their ARV tablets because of communication. Initially, it could have been that the person feels feels very low, feels demotivated, but also has been stigmatized, or the community feels this person should just die, not have to go for their therapy. So through health communication, you'll be able to motivate certain people to change their type of health behavior, but also you'll be able to motivate them to have better health seeking behaviors. Now, the fourth one is persuasion. Persuasion is a conscious attempt by one individual to change or influence the general benefits, understanding, values, and behavior of another individual or group of individuals in some desired way. It can change lifestyle as it is employed deliberately to manipulate feelings, attitudes, and beliefs. It is also a kind of force that reinforces knowledge, attitude, and behavior. So in persuasion, you're able to consciously divert someone's mind. And in persuasion, what happens is that what you're trying to do is you deliberately discussing someone, giving them information, but also in another way, you're forcing them to take a particular direction which you feel is proper. This most times does not apply to voluntary services. For example, family planning, safe male circumcision, voluntary HIV testing. Most times in your communication, you may not have to persuade someone in a very forceful way. However, you can provide them with persuasive information such as that its protection against HIV is about 60% or 40%. So if you told someone that SMC or safe male circumcision, the impact is about 40% or 60% in trying to protect you against any sexually transmitted diseases, then you're persuading them in the right way. However, in offering family planning services, most times it is not a device to persuade people. You rather provide them with the first function of information, and then they are able to choose the kind of method they intend to use. Another function is counseling. Counseling relies heavily on communication and relationship skills. Counseling is the service offered to the individual who is undergoing a problem and needs professional help to overcome it. Therefore, counseling is a process that can help people understand better and deal with their problems and communicate better with those with whom they are emotionally involved. Okay. So it can improve and reinforce motivation to change behavior and helps to reduce or solve problems. So in health communication, you're also offering a function of counseling. However, you must be having the counseling skills, and you must keep the, the, the counseling principles where you must provide the privacy, you must be able to uh, keep someone's information confidential. So as you communicate to your client, in terms of offering them information, giving them education, but also persuading them, you must offer them a counseling session so that they can change. For example, for those who are smoking, you will be able to offer them counseling and advise them so that they can retract such behavior. Then another function is health development and organization. Health communication can play an important role in health development by helping to diffuse knowledge in respect of the goals of development and preparing the people for the roles expected of them. It is a means of intra and intersectoral coordination. Intra meaning within the organization, but also intersectoral meaning within different organizations. And there are vertical communications which can be downward or upward that include top administrator to the beneficiaries and horizontal or cross communication which takes place usually between equals at any level. So what this particular function is trying to mean is that in health communication, we are able to have the health developed, but also an organization formed that the people are developing or developing positive ideas, having a positive health behaviors in an internal surface, but also externally among the people. So when you're doing communication, it may start from an administrator being a health worker. In that regard, if we are referring to a health facility, possibly we're talking about a midwife who will be talking to mothers at the maternity ward and discussing and talking to them about the benefits of having a minimum of 8 antenatal visits. But also, we look at it from a discussion between a VHT or a village health worker or a community health worker among themselves at that level and trying to discuss the different healthy behaviors that can be adopted. So we want to discuss what we call from the education here, from this function of education, we want to discuss what we call health education in that regard, so that after we have discussed the health education, we shall be able to discuss how we can design an effective health communication campaign. So, health education that has been highlighted here as a function of health communication is a broader aspect that we need to understand. Uh, yes, so let me share the screen of health education. I don't know if it is being shared yet. No, let me share for you the screen so that we can discuss health education. So we also need to understand the definition and scope of health education. So health education is the process of imparting knowledge, skills, attitudes, and values to individuals and communities to promote and maintain good health. It aims to empower individuals and communities to make informed decisions and take actions that promote healthy behavior and prevent disease. So when you're discussing these particular topics here, it is very crucial that you differentiate them. Last time, the gentleman who was asking the difference between these terms, now I think we are at par here. We have discussed, we have been able to discuss health promotion, we've been able to discuss health education, and we have been able to discuss health communication. So, whereas health communication is the study and use of communication strategies to inform and influence people, uh, health education is the process of imparting knowledge, meaning giving individuals knowledge. Either you're offering them skills, you're offering them knowledge, you're offering them attitude and values. For example, if you're going for a health education talk, you should be able to, if it is about sexual reproductive health, if you're discussing about HIV testing, you should be able to offer them an alternative skill of testing self testing. That will offer a skill. But you can also offer them a skill on nutrition, that which type of foods can you cook and how can you do them. Many health facilities have been asked to have what they call uh, they have gardens, but they are nutrition farms, and they are just a way of showing people uh, as a demonstration farm the different type of fruits or the different type of food that you can grow in a very small yard, and you will be able to maintain your nutrition values. So this is what happens. You're offering them knowledge, but also in attitude, you're trying to offer them knowledge and you're trying to demystify their myth. The myth that if you're pregnant and you have you go and ease yourself or you go and defecate in a toilet, then it is your child will have a miscarriage. This kind of myth. So in your health education, you can be able to offer this. So health education covers a very wide range of topics, which include nutrition, physical activity, sexual and reproductive health, substance use, and mental health, as I have elaborated in those examples. Health education has a long history dating back to ancient civilization, where healers and shamans provided health advice to their communities. In the modern era, health education began to emerge as a formal discipline in the early 20th century with the development of schools of public health and establishment of government agencies focused on health promotion and disease prevention. So you realize that our ancient people who were healers, herbal practitioners, were providing advice that whereas for us in the early in modern medicine, whereas in the 19th centuries or the very early centuries, 20th century, when we're talking 20th century, we're talking about the 19s, around 19s, and then today we're in the 21st century, which is the 2000s. And so when our ancient ancestors were practicing, they would offer you advice on which herbs you can actually have if you wanted to prevent a certain illness, but also as a therapeutic that when you're now suffering an illness, they offer you a therapeutic. But also uh, they would offer people advice on certain types of illness. So not until the 20th century, that is when now the modern medicine started to understand that there was need for health education, and that is when the establishment of government agencies started to focus on health promotion and disease prevention. So the 1970s and the 1980s saw a significant expansion of the health education with the development of health education theories and modules, the creation of professional organizations and certification programs, and the increasing recognition of the role of health education. So this started in the 1970s, and consequently, different energies started to be put, and people started recognizing health education. So, what are some of the roles of health education? Health education is important in various settings, including schools, workplaces, healthcare settings, community organizations, and online platforms. Health education promotes healthy behaviors and lifestyles that can reduce the risk of chronic diseases. Health education can also help reduce health disparities by addressing social and environmental factors that may influence health outcomes. So, when we're talking about the settings, we are just talking about places where health education can be carried on. And that is why we are able to see the schools and healthcare settings. And when we're talking about reducing health disparities, we are continuously talking about addressing issues of social and environmental factors. So, in your health education, you're able to offer people information about open defecation so that they do not they do not refuse to construct these latrines, or they need to understand the matrix of having a rubbish collection pit so that they do not just throw rubbish as they wish. It would not be very much important. It also helps prevent infectious disease by promoting immunization and other preventive measures. Uh, people start to go for immunizations. People start to clear their bushes. People start to dump their rubbish in places that are meant to be for the rubbish, in the rubbish pits. People start to wash their hands more frequently. You start to realize an increase in hand washing. People start looking for safe water. All these practices or behaviors are adopted with a continuous health education, and it is the role health education plays in there. So, implementing and evaluating health education programs. These are the key steps that are involved in the planning and implementation process. One, needs assessment and program planning. The first step in planning a health education program is to conduct a needs assessment, which involves gathering information about the health needs and behaviors of the target population. So, when we discuss health communication, you may realize that these implementing programs may be similar because communication is as similar, but of course not the same, but as similar with health education. So what involves needs assessment? When we are discussing needs assessment, we are talking about going to the community and understanding. You have to gather information about the health needs and behaviors of the target group. So this is where the use of your health behavior modules or theories comes in. You have to go to the community, obtain the information they need through surveys, focus groups, interviews, or other methods. If you go to the community and just implement a health education program, you may go to a community and find women only attending your health education program, and you offer them family planning information. Yet you realize that actually it is women who are elderly who are attending your health education program. So your health education program will have no impact at all because you chose the wrong topic to discuss, but also you did not go to the community and understand their specific needs. So it is very important that you go and collect information on the needs of the community and very much understand what they want or what their most important need is. So you may just note their needs and rank them accordingly. They may have a lot of needs, but you rank them from the least to the most important need that the community has identified. Two is setting goals and objectives. So based on your assessment, your needs assessment, you need to develop goals and objectives. And these objectives should be SMART. You need to choose an objective that is specific. You need to choose an objective that is measurable, achievable, relevant, and time bound. So if your aim or if your objective is to improve the knowledge on maternal breastfeeding among women, say in a particular province, you should say then you want to increase if your baseline percentage was 10, then you want to increase by 5% by say 2024 or say after 6 months, meaning that goal would be already SMART. But if you say that you want to increase the knowledge among on maternal breastfeeding among women of reproductive age in say this particular province from 10% to 90% by 2024, then you would realize that actually your goal is very ambiguous. It is extremely unmeasurable. It may be, yes, it may be measurable, but it may not be achievable. So you would have overset your goal. So when you're setting goals for your health education programs, they must be SMART. They should be based on the needs assessment and should align with the overall mission and vision of the health education program. Goals and objectives can include desired behavior changes, knowledge gains, or improvement in health outcomes, as I have elaborated using the maternal breastfeeding. Design materials. So they should be designed to engage and motivate the target audience to adopt healthy behaviors and make informed decisions about their health. Health education materials include brochures, videos, social media posts, and interactive websites. So it is very important, actually, it is here, choosing effective communication channel. So after you have designed your materials, you must be having in your background here the kind of communication channel that you must choose. Effective communication channels are those that reach the target audience. Now, the different communication channels may be appropriate for different audiences, such as social media for younger audiences or print media for older adults. Consideration for choosing effective communication channels include the audience characteristics, message content, and available resources. So, this is actually the gist of why many health education programs do not yield, because in most cases, people choose the wrong channel of communication. So this statement is actually encouraging and advising you that possibly you can choose social media for younger audiences, especially for youth. If you wanted your message to spread very fast, you needed to use TikTok. If you use TikTok, you may actually cover majority of the young females. If you use the social media like Facebook, WhatsApp, Twitter, Instagram, YouTube, yes, you would be able to attract the younger people. But also, if you wanted to attract older people who are literate or who are elites, who have possibly gone to school and can read and write, those individuals, they are very conservative on print media, newspapers. If you give them a newspaper, if you give them a flyer, yes, that would work. But there's also a specific type of young men who, for them, would want road drives, music. They want music. That is why you realize the telecommunication companies use music to drive the kind of information that they want. If it is MTN or Safaricom or Airtel, you would realize where they are going to do what they call a promotion. They will put their music that can attract people, and then they are able to pass their message. So similarly, if you are implementing a health education program, you must choose the most effective kind of channel. Most times it is hard to choose channels for young people, especially the children, but you realize that you need to understand the age group of the mothers of those children, what we call a female cohort analysis. If you're able to analyze the type of female that have children, the mothers of the children in that community, you'll be able to develop an appropriate uh, kind of message for that particular uh, society. Then you need to engage stakeholders as another very important aspect when you are implementing and evaluating a health education program. You need to engage stakeholders and partners. Stakeholders and partners can play an important role in planning and implementing health education programs. They can provide valuable insights into the needs and preferences of the target audience, as well as contribute resources and expertise to the program. Examples of stakeholders and partners include community organizations, healthcare providers, schools, and government agencies are also another key stakeholders in achieving positive results in health education. are the politicians, because the society most times believes in them, and through the information that if you pass your information through politicians, there are chances that their voters may be able to receive the information positively. But also you can include government agencies as part of that health education. Health education programs should be implemented with fidelity to the planned program and should be continuously monitored and evaluated to determine their effectiveness. Fidelity meaning as planned, uh, you must strictly adopt to your plan, but you must continuously monitor and evaluate the progress of your health education through feedbacks. So evaluation includes process evaluation, which assesses the program and the outcome, which measures the impact of the program on behavior change, knowledge, and health outcomes. So evaluation can be used to make improvement to the program and guide future planning efforts. So you should not be able to just complete your health education talk without doing a simple evaluation or feedback. Most times, after you've passed your message, you've invited, first you go to the community and do the assessment. After you've assessed, you design the type of message that you want, basing on the needs of the community. Then you can be able to involve the stakeholders. You can choose the channel of communication. So after you've done all this, you've presented your message, you must be able to go back and ask for feedback from the community. Sometimes the community might say, just the way sometimes I ask feedback back from you, that how did the lecture go, then the feedback can come to you, and at the end you will be able to improve your program. So you should not center your argument when you're making a health education. You should not make it as if you're the end and you're the beginning. Mm. So it is it may be hard if you put yourself as a dictator. The community will just say, that man, he thinks he knows our problems, yet he does not know. So you must seek feedback from the community. So, communication and teaching skills for health education. Now, communication theory and principles, effective communication strategies for health education, health literacy and cultural competence, teaching and facilitation skills for health education, motivational interviewing and behavior change counseling. Effective communication and teaching skills are critical components of health education, as they help to engage individuals and motivate individuals. So you need to have communication skills if you're to if you if you're to have your health education successfully done. And communication skills involve understanding your audience and understanding the rhythm in which you must communicate effectively. And they include audibility. You must be able to be audible to your kind of audience that you're talking to. So theory and principles, there are different communication theory frameworks that can help us understand better how to communicate. But in this particular lecture, we will not be able to yet cover the communication theories, because our focus for now is yet the aspect of health education. When we reach promotion, after understanding the health behavior theory, we shall now come and discuss communication theory on how you should be able to present your health information to the community. So a health educator should be familiar with communication theories and principles to develop effective health education messages. So effective communication strategies for health education include using clear and simple language, using visual aids and multimedia, using storytelling and personal narratives. So these are just some of the skills that you should be using when you're doing effective communication. You use visual aids. If you are going to have your health education among young people, it is no use that you take their notes, a lot of notes, background of this and that. You just need to, if you just need to draw there a picture, just put there a visual aid, something you can visualize and put there. When the children see it, they will be able to understand what you are meaning. You need to use different types of media. Multimedia, meaning you can use a TV station, a radio station, you can be able to meet them physically, you can use WhatsApp, you can do campaigns in schools. Yes, all those are effective strategies you're trying to use. So, tailoring messages to the needs and preference of the audience is also another effective communication skill. When you're discussing, when you're talking to a group of people on a health issue, you cannot uh, go outside what the community desires or the need of the community. What is very important is that as you're designing this particular message, after you've carried out the need of the society, if for example you've designed a health education topic on maternal nutrition or on maternal deliveries or deliveries at the health facility, institutional delivery, then you've invited mothers with their husbands, and then when you reach the health education talk, then you start to discuss other issues that are away from what you invited them for or what the community preferred. Then you're going to bore them, and at the end they will become rowdy, and the audience will not be able to pick what specific information you wanted to deliver to them. Then health literacy and cultural competence. Health literacy refers to an individual's ability to understand and use health information to make informed decisions about their health. Cultural competence refers to the ability to understand differences and tailor health education messages and materials to different cultures and languages. So you must be able to understand the type of information that you're offering people. That is one. Two, you must be able to understand the culture where you're going to offer this specific health education. So, as a health educator, you must have health literacy, information. You must have information and how these people can use this information to make informed decisions. And you must be able to understand the differences that tailor health education messages and material to different cultures. So, when we're discussing understanding cultural differences, uh, when you go to a community and you understand their demographic, you understand that culture is actually a way of living for a group, a common way of living for a group of people. Whereas there are what we call traditional values and norms that are a larger culture that are shared across a group of people. They are actually cultures that are very small. You may realize that there is just one community. For them, in their culture, they believe in a specific thing. You may realize that there is a culture of sexual workers, there is a culture of homosexuals or LGBTQ practitioners. You may also realize there is a culture among teenagers. You may realize there is a culture among pregnant women. You realize there is a culture among teachers. You realize there's a culture among midwives. So when we're talking about culture, you may not need to definitely only look at the traditional aspect of it, but we're talking about a common way of living among a common group of people who who uh, who are attest to that type of behavior or norm. So it is important that when you're designing, you should be culturally competent in that health education. You also need to have teaching and facilitation skills for health education. Most times, the difference, the challenge we have is that when many of our students go to conduct health education, they feel it is like a lecture. Like now here, you're seated there very quiet, and you have to listen to me from here. Eh? This side, you have to listen to me, and I pump you with the information for about an hour, and then at the end you just come and raise a few questions. Now that in a community setting or in a health education setting may become very boring. It may not be easy for them to sit for about an hour listening just to you to preach to them. So you need to have those skills, teaching and facilitation, meaning one, you are able to offer them real life examples. Two, you're able to make the session interactive, very interactive, that people can actually ask questions. You can ask someone, a mother, to give you their experience. You ask them to share with you their experience. Why are you doing this? Why are you doing that? Why don't people in your community deliver in the hospital? So you realize at the end, if you make the health education session very interactive, you'll be able to generate a lot of ideas from these people, and they will be able to offer you information that you might have not got if you did not have these particular skills of teaching and facilitating people. Health educators should be able to design and deliver effective health education programs, including lesson planning, group facilitation, and classroom management. They should also be able to evaluate learning outcomes and adjust teaching methods as needed. This is now where I talked about feedback. You will need feedback from the people you're giving your information to. Did they understand? If they did not, what needs to be done? Some will tell you next time come with photos, come with videos. Sometimes they will tell you we need to have a group discussion. Some will tell you we need a break after 30 minutes. So all these ideas will help you to improve the session that you're offering as a health educator. You're more of a teacher, so you need to have how you plan your lesson. What topics am I going to discuss in this health education? How do I engage groups? Then how do I manage my class? There are people sometimes who may even just sit for 1 minute and go. Sit 2 minutes, they walk out. 3 minutes, they walk out. 4 minutes, they walk out. They go and receive calls. Some receive calls within, just that our interaction here may be online, so I may not be able to know what some of you may be doing. Some people may be walking away because they are muting. They are muting. No one is able to see you, so you can actually move as much as you may wish. But the advantage here is that a health education is a physical bit of it. So sometimes when you have this type of interruptions, people moving out and there, you may realize in a session there is that particular person that wants to have opinion more than others. So it is upon you that before the health education starts, you can set a ground, some rules that the audience can set themselves so that the session is delivered, most importantly, in a very crucial manner. So we have motivational interviewing and behavior change counseling. So when you're discussing, when you're offering your health education, do not offer information that is very harsh. That yeah, if you don't come for vaccination, you will die. If you don't slash your compound, mosquitoes will bite you, you will get malaria. It is up to you. Or you tell them that, for if you don't want to deliver in the hospital, it is up to you. When your child dies, we have no problem. So when you're offering this information, you need to have a mode of counseling, and you need to talk in a motivating way. You need to tell them that you see, when your children come to the hospital, they will be able to be given this drug. This drug, your child cannot develop polio. Polio is the one that makes people lame. That if you don't want your child to be lame, you better come and have this kind of uh, vaccination or immunization. So you may be threatening them a little, but you're not giving them a blunt statement, meaning you're offering them a persuasive kind of information. So that is why it is important that you have communication skills. So these approaches involve using open-ended questions, reflective listening, and empathy to help individuals overcome barriers to behavior change. Empathy, not sympathy. Sympathy does not mean. Sympathy means that when you see your client crying, you may also start to cry. You may also start to cry. But in empathy, we are talking about the fact that when this client is feeling very bad, sometimes you may find this might be a HIV positive client. So if you're offering them information to these clients, if you're offering them a health education, it is important that you just discuss with them empathetically, meaning you tell them all will be well. Do not worry. When you take this your medicine, you will be able to come back to a healthy life, and you will be able to live healthy. The only important thing you need to do is to follow your drug schedules. That is all you need to talk. Reflective listening. You need to pay attention to when the client is talking to you so that you can be able to listen to the type of information that they are talking about. And you're also able to ask open-ended questions, not ask them questions that are close-ended. Uh, for example, you're getting a young girl who is pregnant for the first time, who is a teenager, and she has come for counseling. Then you ask, did you have sex with that boy yesterday? That would be a very hard question for them to ask, to answer. So you need to ask them, by any chance, were you able to go to the boys' home? Like that, you need to probe them more and more in your health education session. Remember, we said that it involves some bit of counseling. So I don't know. We have spent 1 hour already. I don't know if that is where we should stop. Otherwise, I just wanted to take us through the strategy for promoting health and preventing disease. I don't know the suggestion because we have exhausted the 1 hour we're supposed to spend. So I don't know what.